Hi, and thanks for joining us for this Medtronic Diabetes webinar with guests Dr. Grant Cracknell and MiniMed 640G insulin pump user, Brent Salzmann. Good evening, gentlemen.
Good evening.
My name is Stuart Mitchell. I'm here at the marketing team at Medtronic Diabetes, and I'll be your host tonight for the Q&A about type 1 diabetes and insulin pump therapy. Before I introduce our two guests tonight, I'd like to recognise the supporters of the Danni Foundation who have joined us this evening. Medtronic are proud supporters of the Danni Foundation, which was established by parents Donna and Brian Meads Barlow as a legacy to their daughter Danni, who had type 1 diabetes and sadly passed away prematurely at age 17. We encourage you to visit danni.org.au to find out more information, and please show your support. Our first guest tonight is Dr. Grant Cracknell. Dr. Cracknell is a consultant endocrinologist working in private practice as a visiting medical officer at St Andrew's War Memorial Hospital and the Wesley Hospital in Brisbane. He has a general endocrine clinic with special interests in insulin pump therapy for patients with type 1 diabetes. He completed his undergraduate science degree at the University of Melbourne before completing his medical degree at the University of Queensland. He is a member of the Endocrine Society of Australia, the Australian Diabetes Society, the American Diabetes Association, the American Endocrine Society, and the European Society of Endocrinology. He is also the co-author of the Thyroid, Adrenal, and Parathyroid chapters in General Practice and Integrative Approach. Welcome, Grant, and thanks for joining us.
Thank you.
Our next guest tonight is Brent Salzmann. Diagnosed with type 1 diabetes at the age of 18 months, multiple daily injections were a familiar routine for Brent. Before switching to an insulin pump in 2010, Brent was prone to being hypo-unaware and quite regularly suffered from debilitating hypos. Brent is currently studying to become a registered nurse and hopes to one day become a diabetes educator. Self-described as always on the go, it's during his clinical placements that his Medtronic pump with SmartGuard has proved particularly invaluable. Thanks for joining us tonight, Brent.
Thank you.
All right, before we move into our first question for this evening, I'd like to just remind you that you can ask live questions. So please use the comment section in this Google Hangouts. You can tweet with hashtag 640G webinar or simply post to our Facebook page. So over to Brent for the first question. Brent, what were your concerns about using an insulin pump and what convinced you to go ahead?
So really I had three major concerns when I was starting insulin pump therapy and looking at starting. It was, would it be right for me and my lifestyle? Where would I put it, and would it be too hard to learn? But I'm here 5 years later after using insulin pump therapy, and I just laugh at myself thinking, what was I thinking? Because it's been a non-issue. And what really convinced me to go ahead with insulin pump therapy would be the fact that towards the end of multiple daily injections, I was doing up to 10 injections a day, which to me, there was no quality of life. So I looked at insulin pump therapy and haven't looked back since.
Great, thanks for sharing that. And that's a lot of injections each day. So over to you, Grant. What would you say to people who are newly diagnosed with type 1 regarding pump therapy?
Thanks, Stuart. I think the first thing to say to anyone who's newly diagnosed with diabetes is don't panic. If you think of yourself as the same person that you were before you had type 1 diabetes, and just now run your... And to that extent, I suppose using an insulin pump can be very useful when you start managing your type 1 diabetes, because it's probably about the most flexible way to manage your insulin. There are some things that you need to be able to manage well before going onto a pump, and they're simple things like giving your insulin, knowing what insulin does, knowing how to manage your insulin when you get sick, and knowing how to test your blood glucose levels and what your goals are. Once you've done that, then managing an insulin pump is not necessarily a big step to take. In fact, it can be quite a refreshing step to take that can give you back that quality of life that Brent talked about earlier on.
Great, thanks for sharing that, Grant, and appreciate the insights. So back to you, Brent. If you had to choose one benefit of the pump, and the MiniMed 640G is what you're on, what would it be?
I'd have to say one of the benefits of the pump is the fact that, like Dr. Cracknell said, it gives you back your freedom pretty much. with SmartGuard on the 640G, it suspends the insulin before you go low, so it's preventing, or tries to prevent. And to me, that works perfect because I really don't have that many hypos anymore compared to what I used to, and it's giving back my quality of life.
Great. Thanks, Brent. Sounds very liberating. Question for Dr. Grant. We are about to start pump start. Why would I choose this pump over any others?
Well, I think there are two pumps on the market that patients generally prefer. One of them, I think, one of the pumps that's available, I think, is not really one that's particularly good one to choose. But out of the two that patients tend to choose, the 640G, I suppose, has a couple of advantages. One of them is the SmartGuard if you happen to choose to use a continuous glucose monitor, and that gives both parents with children with type 1 diabetes a lot of, I suppose, peace of mind that when their kids are sleeping, that they're less likely to have hypos overnight. And for those and go to bed and know that your SmartGuard will turn your pump off. And that's a feature that's really only found in one pump, and that's the Medtronic 640G. The other benefit is, and this becomes very apparent when I see patients day to day, is that there are a lot of times that patients will check their blood glucose levels, but not actually take out their pump and put them into their pump. What I mean by that is the 640G has a linked glucometer. So it means whenever you check your blood glucose levels, that glucose level will straight away go into your pump and will give you the opportunity of being able to correct for a glucose level that's not where you want it to be without having to pull it out, put in the glucose level itself, and then roll it away. And it means that it gives you both more control, and then when you also come and see me in the rooms, or your endocrinologist in the rooms, you've got much more information about what your blood glucose levels are doing throughout the day when you've tested them. One of the pumps that patients tend to use doesn't have a linked meter to it, and it's not uncommon for patients to turn up and say, here's my pump, here's my download, can you have a look and give me a hand? But I've checked my blood glucose levels, but they're actually not in my pump download, so it makes it really hard to help them look after their diabetes. So really I think the two keys are a SmartGuard and also your linked glucometer, which makes things a lot easier.
Great, thanks for that, Grant. Back to you, Brent, and quite a common question. Do you find the pump to be obtrusive or get in the way, given that it's attached to your body?
I really do not notice my pump at all when it's attached to me. It's really a non-issue. Once you get used to it after the first couple of weeks, you don't even notice it's there until you pull it out of your pocket and do boluses. All I can say is the tubing just comes in handy when you accidentally drop it. So it becomes sort of a safety net, and it's really just no issue.
Yeah, great. And on that topic, what is it like to sleep with an insulin pump attached to your body?
Again, I really don't have any issues with that. I just put it beside me in my bed, and it just really follows you around, doesn't wrap around, doesn't pull out, so there's none of those fears of it stopping during the night. People tend to put it under their pillows, put pockets in their pajamas. It's really up to you. There's so many ways that you can put your pump in, you just really don't notice it.
Great. It's very nice to know that. Back to you, Grant. What would your advice be to parents whose child is newly diagnosed with type 1 regarding pump therapy?
I think actually for parents with children, I think the choice of moving to pump, and I'm not a paediatrician, so I have to say I'm an adult endocrinologist, and so I don't have lots of parents coming along with newly diagnosed children with type 1 diabetes. But I think those who do have young kids who have managed their children through their young years find the pump can be particularly helpful because they've got the ability to be able to change the insulin on the run. And having been at a children's diabetes camp where they all had type 1 diabetes and were running around, swimming, treasure hunting, canoeing, etc., if you can get a stable glucose level in a child, you win an award from me. It is very difficult, and you often need to make changes to insulin on the run. I think an insulin pump gives a lot of flexibility with that, and I think if you use the SmartGuard, that also gives you a lot of peace of mind, as I alluded to before, being able to have your child go off to sleep and not have to sneak into their bedroom at 10 o'clock at night, at 2 o'clock in the morning, and then at 5 o'clock in the morning to make sure that they haven't gone low overnight or not having any hypos that they're sleeping through. So I think, and I think the statistics would point out that, in fact, children tend to be much more likely to go onto a pump than adults are. And I think it's really about parents having the flexibility with their kids and knowing that they're a little bit safer.
Great, thanks for that answer. Back to you, Brent, and we alluded to this in your introduction, but how many hypos do you get now that you're on the pump?
With the pump now, I'd say I'd be getting about 1 to 2 lows a week, and especially with SmartGuard, I'm seeing that decrease even further because it just prevents most of them for me. Prior to pump therapy, I would be looking at 1 hypo every day, sometimes 2, so it's definitely reduced it for me and makes me feel a lot better now because I would often feel wiped out after lows, so I don't have that really anymore.
Great, it's a great news story. And still with you there, Brent, a question. I'm nervous about using this device accurately. How will I learn to live with a pump?
For me, I really didn't. It was very straightforward learning how to use the pump. The screen is very bright and easy to read. It's got a colour screen, so again, it's easy to see. And the menus just make sense. They're all in what I consider logical order, so there was anything to surprise me when I started using the 640G.
Great. Dr. Grant, how does the pump help issues of long-term complications?
Okay, so I suppose long-term complications are based around diabetes control. How well can you keep your blood sugar levels controlled? And measuring that by what's called an HbA1c, which is a 3-month average of your glucose. And we use that to try and anticipate, is someone at risk of developing complications in the long term. The studies of insulin pumps compared to the older insulins we used to use suggest that you can get a drop in your HbA1c. Depending on how high your HbA1c is, you can get a drop in your HbA1c of up to 2%. For most people, a drop in HbA1c of around about 0.7% is possible going onto a pump. But I would say from the point of view of using your pump, it gives you a lot more flexibility, and if that then gives you the ability to be able to bolus for all of your meals and much tighter control, that is then what tends to protect you from complications long term. What also tends to limit people from getting tight control, particularly overnight, and Brent, you might want to comment on this, is patients will often feel very afraid about fixing a higher glucose level before they go to bed, particularly just before they go to bed, for fear that if they get it wrong, they'll have a hypo overnight. Your pump is probably the device that will give you the most accurate control of your glucose level overnight and minimise your risk of hypoglycemia while you're sleeping. And I think that goes a long way to actually help people control their glucose long term and prevent complications.
Great. So over to you, Brent, with the same question. How have you found it help long-term complications? And before you speak, I'd just like to remind our audience there's a chance to ask questions on the Google Hangouts. You can tweet #640G webinar or post a comment or a question on our Facebook page. But back to you, Brent.
Before pumps, I was really scared about complications because my control wasn't the best. So going onto the pump, I was very much looking forward to reducing all those highs and lows, and it's done exactly that. Like Dr. Cracknell said, my biggest fear was having lows during the night because that's where most of mine were occurring. So I would actually run myself higher, but now with insulin pump therapy, I know I've got that really tight control overnight, and I don't have many overnight hypos anymore.
Yeah, that's great. Question for both of you again, but we'll ask Grant first. So what can you do on a pump that you can't do with multiple daily injections?
Yeah, and I think that's a really good question. So if you think of, and I'll use some brand names here, but if you think of your long-acting insulin and your short-acting insulin, so once you put your insulin in, you can't do anything about taking it out. So if you're using a long-acting insulin like Lantus or Levemir or Protophane, etc., once you've injected your dose, that will then start to release the insulin at a fairly constant rate over 12, 24, 16 hours, and you can't change it. And that can be a problem if you then increase your activity. So if all of a sudden you start doing housework running around and playing sport to try and work against that insulin, which is trying to bring your glucose levels down like your exercise. What you can do with a pump is be able to say, right, at the moment I'd like to turn my insulin down because I don't need so much for the next few hours. I'm going to turn my basal rate down, give myself less insulin, and therefore I won't have to necessarily eat before I exercise. And then when I'm finished exercising, I'm less likely to have any lows afterwards because I'm going to keep it at a lower rate for the next couple of hours. So that's certainly one feature that is particularly helpful with a pump, and that you can adjust it. The other one that I had mentioned earlier on is really you can, with pens, inject 8 or 9 times a day, or as Brent was doing, 10 times a day to try and get tight control. Lots of patients won't do that, particularly if you happen to be out having dinner with friends and you feel a bit conscious about lifting up your shirt or lifting up your skirt to be able to inject into your leg, etc. With a pump, it can be as simple as pulling out your glucometer that's attached to your meter, pushing a button and bolusing for food. And so managing your insulin can also be a little more discreet than using pens or syringes.
Great, thanks for that, Grant. And over to you, Brent. How have you found being on a pump? What can you do on there that you couldn't do with injections previously?
Like Dr. Cracknell said, the fact that you are not locked into your insulin, so with my unpredictable lifestyle being a student nurse, you don't know what's going to happen, and being on long-acting would have prevented me from being able to change it and give me more lows, but with the pump now I can just quickly go in, set a temporary basal which decreases your insulin for how long you want it, and now I just don't have that worry anymore of those lows. And something I couldn't do on injections was deal with high-fat foods or foods with high GI. They would often send my blood sugar really high and then send me hypo. But with the pump, you've got the option of dual wave, which lets you have insulin now and over a certain amount of time. So it reduces that unpredictableness of when you occasionally have those foods, and it means I don't have those hypos, and it's just a nice, smooth blood glucose afterwards.
Great, thanks, Brent. So being on a pump for you still, Brent, what kind of difference has that made when you've gone to see your healthcare professional, such as an endocrinologist?
Like Dr. Cracknell touched on before, he said the focus moves away from, okay, what's happening here, here, and here, not having any information, to being able to have all this information available to you and go, okay, this is what we're going to do, this is what's happening at this time. So being able to see everything in one place with the software just means my relationship's just got a lot better with focusing on working out problems rather than working out, okay, what did we do this day?
Excellent. And across to you, Grant. How do your consultations differ for patients that are using insulin pump therapy?
I suppose they differ from the point of view that we tend to actually make a lot more progress, and you get a lot more ability to be able to tighten glucose, a patient's glucose control, and therefore in the end have less problems with complications. Brent's quite right. You'll often sit down, if you're not on a pump, where you don't have your time of the day, what your blood sugar level was, how much you ate, and what you bolused. When you don't have 5 days, do you remember how much insulin you had at that time? Because it seemed to work pretty well that day, but then the next day your blood sugar level was the same and it was really quite high afterwards. Do you remember what you did there? And of course, I don't remember what I did 2 days ago, and neither do the patients. They won't remember what doses of insulin they gave. So sitting down with a patient after having done a pump download is not too dissimilar to helping anyone come in, and that is really the big picture. What do you want to do? Where do we need to get your glucose to? And what issues are you having in diabetes at the moment? But having the software that comes with the pump, particularly with the Medtronic pump, allows me to be able to sit down with the patient and say, right, I can see there's some issues there. I can see what's going on. Let's sit down and sort that out and make some changes to the pump settings that I think will be able to give you tighter control without the hypos.
Excellent, thank you. And still with you there, Grant, on average, how have you seen HbA1c levels change in your patients with insulin pump therapy? And I guess for the crowd, please explain what HbA1c means to begin with.
Yeah, thank you. So an HbA1c is really, if you like, the way of measuring your average glucose level over 3 months. So if you think of the climate and the weather outside here in Brisbane at the moment is probably pretty cool, but Brisbane's a nice place to be. And so it's cold weather, but it's nice climate. So if we think about your glucose levels as being the weather and your HbA1c being the climate, it gives you an idea about are your blood sugar levels generally high? Are your blood sugar levels generally low? What's the average? And so what we try and do is get HbA1c to a level that then means your body sees a fairly normal glucose level over a long period of time, and that's what keeps you healthy. I'm going to come back to your question now that I've said that. Can you ask the question again, please, Stuart?
So it was, on average, how have you seen HbA1c levels change in your patients with insulin pump therapy?
I suppose I probably couldn't quantify it as to how much drop there has been, but I don't think I have had a patient who has not improved their HbA1c having gone onto a pump. And I think I've had one person who's gone onto a pump who stopped, and all the others have said this was the best thing that I ever did for my diabetes. Without any exception, I've had patients who say this has given me my quality of life back again, and why didn't I do this earlier? And so most patients would say that this is a very positive step forward, even if their HbA1c hasn't changed that much.
Mm-hmm. Excellent, great. And just a reminder for the crowd, if you have a question, please feel free to ask it in the Hangout session. You can tweet #640GWebinar, or please go onto the Facebook page. All right, over to you, Brent, and also a question for Grant too. So how is the MiniMed 640G different from the Paradigm Veo?
I think the 640G is a lot different, considering it has a different form factor now. It's all portrait. It's got the nice big colour screen on it. It's got the new SmartGuard technology. As I said, it suspends when you go low. And just, yeah, the easy-to-use menu, I would say, probably one of the big draw cards. And the fact that you can bolus off the meter now, so you can have a preset bolus and just bolus on the fly without having to take your pump out anymore, which is really convenient.
Absolutely, that's great. And how about you, Grant? What differences have you seen in the 640G compared to the Paradigm Veo?
Yes, I suppose there are two technological advances in the 640G. The one that Brent alluded to, and that is the SmartGuard, which is really quite a leap forward in terms of protecting from hypos. The other thing is it's now waterproof, which is great. And so if it happens to get wet and you hop into the shower forgetting to take it off, or someone pushes you in the pool, it will survive that. From a point of view of ease of use, there are some other nice features in there, so that Brent talked a little bit about use basal rate previously for playing sports, or for now I'm about to go and that button that I would normally play before I play tennis, and it's going to set up my temporary basal rate, which will run at 70% for the next 2 hours, and then go back to normal. Or you can set a preset bolus for particular foods or activities. So there are those nice, if I can call them macro features in the pump that just automate some of the things that you have to do day to day and makes them a little bit easier.
Excellent, thank you for that. And still with you there, Grant, a question from the registration. Why would my blood sugars be going high 2 hours after dinner?
Yeah, I suppose your insulin takes around about 3 hours to fully work, and your food can often take 2 to 3 hours to come through as well. So if you check your blood sugar levels half an hour, 1 hour, 2 hours after a meal, you often see that the insulin hasn't quite had its effect. Brent mentioned about fatty foods, and the typical things are pizzas, which have a lot of carbohydrates in them, but a lot of cheese and a lot of fat on them. That food can take quite a few hours, a number of hours to come through. Even with really high carbohydrate foods like pastas, etc., you'll often see that the glucose will come through much more slowly. So you really need to give your insulin and your body a chance to digest blood glucose down 2 hours after a meal. If you're not on a pump and you give some extra insulin, you have to be a bit careful, because you've still got what's called a little bit of insulin working, or insulin on board. There are a couple of non-pump meters that will allow you to work out how much of that insulin is still working after a previous dose, and it's a feature that is common to the 640G. So if you have bolused for a meal 2 hours ago and you check your blood sugar level and it's still high, your pump will be able to work out how much of your previous dose is still working and take that into account and say, actually, don't do anything about that. It will come down. Or, no, actually, it hasn't come down as much as you think. Yes, you should have some more. So it provides that ability to be able to bolus on the run, if you like, and know that you're not putting.
All right, thanks Grant for that. Across to you, Brent, and a bit of a change in questions. Can you tell me what CareLink is? And just before you speak, just a reminder for the crowd, last questions to come through. If you'd like to get a question in before the session ends, feel free to send your questions through in the Hangouts or tweet us the hashtag 640GWebinar. Back to you, Brent.
So CareLink is the software that comes with your pump where you can upload your pump and it takes your pump data such as all your boluses or your temporary basals and takes all your blood glucose from your meter that are stored on the pump and puts it onto software where it can produce graphs and charts to show you where things are happening and what is happening at certain times. So it definitely lets you pinpoint to a time frame of, okay, this is happening, this is what happened then, and it just creates such a bigger picture with the software.
Great, thanks for that, Brent. And across to you, Grant. How many of your patients have stopped using insulin pump therapy after starting?
I've had just one patient who stopped, and yeah, that's been it. As I said, everyone else has said it was a great idea, or this has been really good. It's given me a fantastic quality of life that I didn't have before, and it's given me much more flexibility and a sense of control of their diabetes again, which they'd often struggled with before. Having said that, the statistics would say that the vast majority of people who start pumps will stay with them, and a small minority of people say that they find it less useful than using pens or needles and go back to using them. So I've only had one person who's actually gone back to their pens.
Excellent. And back to you, Brent. Can you feel the cannula from the infusion set under your skin once you have inserted it?
No, not at all. Once it's in there, you can't feel any of the insulin going through. Like I said, I don't notice it half the time. It just sits there, and when I need to use it, I grab it. There's no pain, no burning, no nothing.
Great, excellent. And still with you there, Brent, do you find you sleep better when using insulin pump therapy with SmartGuard?
Definitely think I sleep better, knowing the fact that I have that safety net there, being able to suspend the insulin if it thinks I'm going low, and it just reduces that fear for me, having that quality of sleep, I think, has definitely come with it. Because I'd be waking up doing 2 a.m. tests prior to using the continuous glucose monitor, but now, no worries. I fully trust it.
Great, thank you for that. And we're almost out of time here, so one more question, and I guess I'll ask this to Grant and Brent. If you want to provide an answer to, that'd be great. So is SmartGuard suitable for everyone?
It can be used by anyone. There's no doubt about that. The reason why it is an extra cost that it's involved in buying the continuous glucose monitor. But there's really no reason why not everyone could use a CMS and a SmartGuard utility in a 640G. So I can't think of any reason why someone could not use one.
Great. And over to you, Brent.
Same thing. I can't see why anyone couldn't. Just the cost, but that's been reduced from what I've heard. And yeah, to me it provides more quality of life. So I really can't put money onto my own health. So I rather spend that money to know that I've got that safety right there.
Excellent. Sounds very good. So just to wrap up, gentlemen, are there any final comments that you'd like to say to people watching who are considering pump therapy? Grant, and then I'll get you to answer that one, Brent.
Thanks. And I suppose the only thing that a pump will not do is manage your diabetes if you don't check your blood sugar level and don't tell it what to do. So certainly if you're looking for a pump because you've had enough of looking after your diabetes and you don't want to look after it anymore, moving to a pump's not going to be helpful to you. If you're looking for control again and looking for flexibility that gives you a quality of life back again, a pump can be very useful. And I think if you talk to your endocrinologist or diabetes educator, they'll give you some more information so you can decide whether that's going to be right for you or not.
Mm-hmm. Great, thank you. And Brent, for the final comments.
I just tell anyone that wants to try pump therapy to just try it. There's nothing to lose by trying it. You can only benefit. Knowing in my case, I only benefited from it. So, yeah, just give it a try if that's what you want to do.
Excellent. Well, thanks, Brent and Grant, for those amazing answers. I'm sure, like me, everyone has appreciated your comments and gained more insight into insulin pump therapy and the MiniMed 640D. So just to wrap things up, I'd like to thank you for joining us tonight for this webinar. If you'd like to continue the conversation, please head to our Facebook page, which is Medtronic Diabetes Oz, or on our Twitter page, which is Diabetes ANZ. If you'd like to speak to someone at Medtronic, please phone 1-800-777-808 or head to our website, which is medtronicdiabetes.com.au. So thanks for joining us, and we hope to speak to you soon.
Thank you.
Thanks.